Thank you very much. Good afternoon. Namaste. Chairpersons and the distinguished leadership of NATHEALTH. Thank you very much for giving me this opportunity to be with you this afternoon and to be able to share a few ideas in our shared journey, shared mission of providing the high quality, affordable, best quality, most affordable healthcare to the people of India. I'm very delighted to be a part of the specific event on the release of the report on Indian Home Healthcare 2.0, redefining the modern care continuum. I truly consider this to be a very timely initiative, and I truly consider this to be a very important initiative when you see it coupled with the report and the foresight that you have laid down in the document on the care of the elderly. Put together, these are very important policy papers, policy documents for all of us to take forward. As rightly pointed out by Meena ji, home care in a way became a norm in the wake of COVID-19 pandemic. In particular, it got refined in the second surge of the wave. This, we could see, could open up possibilities of providing similar kind of continuum of care in a safe manner, supported by IT, supported by health professionals in other priority illnesses, health conditions, and even for promoting healthcare for that matter. So I'm very proud and very happy that I had a chance to receive a presentation on the ideas contained in this report. And I appreciated a lot of wisdom that has been put in the document, but also challenged in some specific areas for more work to be done and more refinements to be done. Very pleased to say that NITI looks forward to working with you closely on both the care of the elderly and home care mission in partnership with state governments, in partnerships with other stakeholders. So very proud to be a part of this, and thank you for doing this work, because if you hadn't done, I had to do it. But now we can do it all together, because this is the necessity of the times. This is the necessity of the nation. Having said that, if you read the report and look at the paradigm used for the report, it is in 3 boxes and very nicely crafted. Regulatory framework and policy reforms, financing, capacity development. And I had suggested that we put a 4th pillar, IT, technology, absorbing, using technology. And that's, of course, mostly an editorial work, because technology would drive quality care. Without technology, home care can still happen, but it would have many more other challenges. Many challenges are sorted out by use of technology, and we just had a session on technologies. But here I am also referring to technologies other than IT technology per se. And let me start from that, therefore. So we have to be co-travelers and co-partners in helping develop the other technologies such as biomedical products, devices, things that assistive technologies that can be so very useful for specific groups in the home setting connected to the health system through the IT linkages. And that is one space which I clearly visible separate from this, and it is a space which brings in the solutions also for the elderly, for those who are disabled. The work that has been done in the area of regulatory framework is really very sharp, by the group that worked on it. It talks about registration and licensing of home care providers, talks about integrating medical care between institutions and home, so ensuring continuum and two-way processes, talks about accreditation and standards of services, standards of care, clinical treatment pathways, and also, of course, all this works through the ethical principles. It works through the privacy principles and all that the medical profession stands for. The issue of capacity building is critical. Issue of giving impetus to this form of care, this extension of care into the homes, which actually becomes the fourth tier of care, which actually always was fourth tier of care, would require reorientation of how we work, what our skills are, acting some of the skills, bringing forth some skills which we may have used less often. So very, very pleased to see the framework that has been used and the work, ideas that have been put in this report. So I congratulate Meena-ji, Vivek-ji, and all the other team that led this work under NATHEALTH. So NATHEALTH, you're doing a splendid job, very proud, and after 2 years of very difficult times, I look forward to more energy and energetic outputs and your vibrant involvement with the larger cause of the health of people of India. And here, let me now add 2 ideas for you to consider. I don't want to miss this opportunity to remind us all of 2 challenges. And those are obvious. One is infrastructure, the other one is human resources. On the infrastructure, time has come that we consider expanding the private healthcare and also the government healthcare system in terms of facilities. I may add here that in the last 7 to 8 years, extensive efforts have been made for expanding the healthcare infrastructure in the public healthcare space. You are aware of our scheme to create 157 medical colleges. You are aware of how 6 AIIMS plus the mother AIIMS in Delhi are now a part of our AIIMS family comprising 22 total institutions. You are aware of the development in regard to the PM ABHIM initiative on infrastructure where care blocks will be built and so on, and laboratory setup will be augmented and so on and so forth. The point I'm making is that when I'm appealing to you to come forward with creating additional infrastructure in the private sector, I'm also saying that in the public sector, in the public space, union and state governments put together are making huge efforts to strengthen the public health system infrastructure. I urge you to consider ways and means of expanding the private health infrastructure. All cities, all towns, but in particular Tier 2 and Tier 3. And let the debate be ignited once again. And also here, an important issue is for you to make infrastructure which is compatible with the business dynamics that emanate from PMJ, Ayushman Bharat PMJ. Because the future expansion would have an interface with financing mechanisms, health insurance schemes of the government, and today that scheme is Ayushman Bharat PMJ. It will expand. It will be made more energetic. Many more of the beneficiaries of today's beneficiaries of the program have to be connected to facilities to receive health care. So the point that I'm making is I urge you that please consider PMJ paradigm to be there to stay. And there, the package rates will be decided in a certain way, which is being refined. But the business model of the existing system perhaps needs to be tuned to the financing that could possibly come from any government health insurance scheme, and here specifically the PMJ, because this will be the umbrella, this is already the umbrella. I may like to inform you that the PMJ's original intent is to cover 500 million people, but even today, several states have included additional beneficiaries, and I believe the number is already close to 65 to 67 crores of beneficiaries. So this is the vehicle on which we are making progress, and it is our shared journey and the shared quest for universal health coverage to the extent of secondary and tertiary care system, and the universal health coverage for primary care. The foundation is the health and wellness centers, and that we can discuss on another day. But we should never forget the 103,000 health and wellness centers that have come up since 2018 in a very short period of time that we're well aware of. So my appeal to you is, can we think of the models of healthcare infrastructure in the private sector space, which are affordable, which are sleek, which are minimal frills. There's always a value addition for those who can afford, but the ones that work on a model which is compatible with the government schemes, and here in particular Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. I may add that this is a very special scheme of the government. It's a scheme which is at the heart of government's efforts for social development, healthcare, and preventing catastrophic expenses on the part of the families. Very, very dear to the Honorable Prime Minister. My second ask, as always, is to please request you to contribute towards capacity of human resources. And here I want to remind you that it is the private sector which has something like 6 lakh beds, and every bed needs to be seen as a bed that provides care, but also provides education to our nurses, to our doctors, to our paramedics, allied health professionals. And here in particular, for meeting the demand and the unmet of our specialists, the DNB programs provide the way for us to work together. You are well aware that if you bring in your resources optimally and to the best possible extent, ideally, then you can unleash possibly 40,000 to 50,000 postgraduate seats, if not more. Currently, there are only about 11,000 DNB seats for the 6 lakh beds that not even 11,000. 11,000 is total. Probably about 9,000 to 8,000 to 9,000 seats are coming from the 5 to 6 lakh secondary tertiary beds that the private sector has. And the other 6 lakh beds are today giving something like 42,000 seats. Even there has to be many more additional capacity initiatives. The short point that I'm making is that we all feel the pinch of inadequate specialist workforce and a doctor workforce and quality nursing workforce. Can we please work together to find ways of doing it? We have to work together. And the real potential treasure of specialist training site in the seats is really with the private sector. DNB is now a well-oiled system. National Board of Examinations has done many reforms. It is very conducive for us to work together. The requirements are very rational. They are very, I would say, optimum. Please join hands. Please see it as a national cause. I know it puts some pressure on your system, including the financial viability at times beyond a point. But then please, we can work together to address that. But this cannot exist that 6 lakh beds are generating 9,000 postgraduate seats from the private sector hospitals, or 5 lakh beds to 9,000 seats. So I plead with you that please be partner for training of specialists, training of nurses, training of specialist nurses, and you're hoping also very soon training of nurse practitioners in the clinical care situation that you deal with. The Honorable Prime Minister had also, in his address recently, requested the private sector to come forward for creating medical colleges, taking initiatives in the medical colleges, creating medical colleges. The large hospitals can be converted into medical colleges, can marry other institutions, we provide the college connect. I may mention here that the Board of Governors in supersession of Medical Council of India have created a scheme where 2 to 3 to 4, I guess, private sector entities can come together. One of you brings the hospital, another one brings a medical college, the college part the medical college, because medical college also has the hospital. And that could be, unused engineering college that you may have, or a building in the heart of the city, which can be quickly converted into a college. And a third one can give the residential facilities for the student which are needed for obvious reasons. So it's possible for private collaboratives to create medical colleges. So think about other ways in which large hospitals can become a part of the medical college or can evolve into a medical college. Is that possible? I think in nation building, it is very critical that the health sector enlarges its scope in the current stage of our development. You are aware that if we have about 12 lakh beds, close to 1 bed per 1,000 population, we need to be 2, even as per the National Health Policy. But we perhaps need to go beyond that to meet the rising needs eventually that this nation has. So both in terms of preparing the infrastructure and also training of specialists in particular, there are areas where you have strong presence. Critical care, we realize in the wake of COVID-19, the center of gravity was in the sector for sure. So kindly look at it dispassionately. We must find a, we have been discussing this even before the COVID-19 struck, and we were trying to find a way together. Please ignite that discussion and make suggestions, but please as we move forward, make a difference in both these fundamentally critical areas of infrastructure as well as quality workforce. I go back to say that I look forward to working with you on taking forward the concept of home care. Being a pediatrician, I must tell you that one of the most important home care in operation in the public sector, public health of India, is the home-based newborn care. It emerged as a model in Gadchiroli, where Dr. Aayog created such a model. I'm very happy and fortunate that I was associated with that work and then associated with being an advocate of that work. Home-based newborn care is in operation since 2011, and it's also accepted accepted across the world as an important approach and is recommended as a norm by the World Health Organization. So there are some interesting lessons out there. Even there, the time has come for us to use technology, and you can help us create those models. Newborn babies being discharged from private hospitals also can be supported through home-based newborn care and technology. In fact, and that's my last point, in fact, an important point I did to Meena on that day was, please tell us the scope of home care. You have in your report articulated the pathway to make that happen. But the technical part, well, before that, the bouquet of services that can potentially reach home with ease and then with some difficulty, and we can group them differently, need to be thought about. And then start building around that and connect this, this delivery paradigm that you have created wonderfully in these 4 buckets that I talked about can be linked. Huge scope, palliation could be a quick win. Health care of the elderly and care of the challenged person would be an early and a priority quick win. Newborn care is an obvious one. You've already done it. Take it forward. Supporting early childhood development through home care. Child is at home. Our mothers do not necessarily know how to get the best care in terms of learning opportunities for the young and also the nurturing care. Everybody needs help. And that could be an early tick. So I'll be particularly happy to see how you look at home care to support child health, newborn health, feeding, complementary feeding, adequate feeding, childhood development. Let me challenge you here by saying, complementary feeding at the right age starts only in about half of Indian children, less than 60%. Adequate feeding between 6 months to 1.5 years is woefully at a level of only 12% according to NFHS. Home care is also home care for nutrition. This could be a game changer. And I would therefore request you, to create what kind of services can be taken to home. We have done it for newborn care, we've done it for COVID. We should on priority do it for the elderly, I think, for sure. And then, of course, other opportunities. With these words, my gratitude to you for excellent work, my best wishes, and our dialogue for the larger mission of making India a global standard of healthcare continue.